Hi everyone, this is Walid Youssef. Today we're gonna talk about 8 types of waste in healthcare. Let me introduce you to concept from lean healthcare. Lean is all about deficiency, eliminating waste, is about creating value for the patient. Lean actually identify 8 types of waste in healthcare. And there is a beautiful acronym for you to remember the 8 types of waste, which is down time. So D is stand for defects, O is stand for overproduction, W is stand for waiting, N is stand for non-utilized talent, T is stand for transportation, I stand for inventory, M stand for motion, E stand for extra processing. We're gonna go through all of them in details in the coming slides. So let us start with the first type of waste, which is defects. What do we mean by defects? We mean by defects is time spent during doing something incorrectly, inspecting for errors or fixing errors. An example for that, surgical case card missing an item, wrong medication or wrong dose administered to the patient. Another beautiful example is also writing illegible handwriting in the patient chart or error in documentation. Those defects, it's a kind of waste because people cannot understand what have written, and this will create more room for errors. So those errors are defects in health care. The second type of waste in healthcare is overproduction. We mean by overproduction is doing more than what is needed by the customer or doing it sooner than needed. An example for that, doing unnecessarily diagnostic procedure. Another example also, let's say you have to document your care plan in a progress note in your file. Then you have to document it again in the electronic file or in the physical file for the patient, etc. So what you are doing is overproducing work. You are duplicating your work. You are doing it several times, which is an effect is a waste because it does not help to add value to the patient. It's only creating more waste. The third type of waste is waiting. Waiting, we mean by it waiting for the next event or care or next work activity. So an example for waiting is waiting by the patient. So if a patient is waiting for long time, for 1 hour to 2 hours to see his physician in the clinic, or if the patient has to wait long time to get some investigation or diagnostic procedure done, or if a patient has to wait long time to get some report. All of these are a waste of time. So waiting in the healthcare is huge waste. Probably it is the biggest kind of waste in health care. Also, waiting can be on the part of healthcare professional. So, for example, if I am a physician and I have to wait to get a particular report for my patient from the lab, and if I've been waiting for a long time, this is also another example of waste. The fourth type of waste is non-utilized talent. We mean by it is waste and lose due to not engaging employee, listening to their idea, or supporting their careers. An example for that, because of this, what we are doing with the employee, for sure our employee will get burned out, I'll quit and quit giving suggestion for improvement. Another example also for that, just imagine a nurse. We underutilize her because she was with a physician, and this physician he took long time to examine the patient and keeping the nurse for her. So this staff we are underutilized here. We are losing her effort in the work environment. The next type of waste is transportation. What do we mean by transportation? Transportation, we mean by it unnecessarily movement of the product. What is those products? Product, we mean by them patient, specimen, material in a system. An example for that, a poor layout, such as the catheter lab or the cath lab is being located a long distance from the emergency department. So this point related mainly with the poor layout in the hospital or in the organization structure. If there is big distance between, for example, cardiac cath and emergency department, or suppose the patient he has to walk from clinic, then he has to walk long distance to the laboratory to do some lab tests, then he has to go to pharmacy. All of those are a waste. The next type of waste is inventory. Inventory is excessive inventory cost through financial cost, storage and movement cost, spoilage wastage. An example for that, expired supply that must be disposed of, such as out-of-date medication. Another beautiful example also, if we order too many bottles of lidocaine, so they will expire because they are more than what we need. Also another example, if we are ordering too many vaccinations, so they will expire. The third example also, it is very beautiful example, if the nurse doing over storage for some consumables, and this over storage of those consumables, it will create shortage in somewhere else in our hospital. And also this is a beautiful example for the inventory. And inventory also, it is one of the important wastage in health care. The next one is motion. What do we mean by motion? Motion, we mean by it unnecessarily movement by employee in the system. So an example for that, lab employee walking miles per day due to poor layout. So this, and also this waste also related to the poor layout in the hospital. If the employee walk big distance between two departments in the hospital, suppose we have one employee in the laboratory and she has to walk a long distance to pneumatic tube to get her samples. This is a waste. We are wasting time. Another example, suppose a nurse, she's caring for her patient, she has to go to fax machine to get some faxes, then from there she has to go to a consumables room to get some consumables. Also, this is another example of motion, and motion also, it's very important wastage in health care. The last type of waste is extra processing. Extra processing, what we mean by it, doing work that is not valued by the customer, or caused by definition of a quality that are not aligned with patient needs. So here we are doing extra processing or unnecessarily processing. We are adding extra process to our work routine or work process. So a beautiful example for that, Assume if I'm a new physician and producing piece of a clinical document, and my supervisor or senior has to come to and examine that document and review it, etc., or add some note to it. This is an extra processing because we are duplicating that work just because you want to make sure about work has been done the first time. So if the work had been done probably first time, you would not need that level of check. So that's extra processing. That's another form of waste in health care. This is the end of our lecture today. Please wait me in the coming lectures also. You will have beautiful coming lectures. Please don't forget to like and subscribe to our channel. See you soon. Thank you so much for your listening.